Hi, welcome to the second episode of Longevity Lounge, where we aim to discuss health and wellness topics to provide actionable advice to our viewers for them to incorporate in their lives to extend their health spans. Saya's mission is not just to extend lifespan, but also health span. Because extending lifespan means living longer but on medical attention. Extending health span, on the other hand, is living healthily for as long as you can and enjoying life till the very end. So today's guest is Dr. Nisha Sancheti, a renowned dentist with over 16 years of experience. She is also the chief dental officer and founder of Salt, a toothpaste that is rooted in sustainability but also redefining luxury. Salt is unlike any other toothpaste that we have ever seen, and we let Dr. Nisha talk about her journey, her experiences, and what prompted her to create Salt in the first place. So, thank you so much for joining us.
Thank you, Karan. I really appreciate it. Thank you for the warm introduction, and I'm truly delighted to be here. And I'm happy that we are doing this together because you understand how important sustainability is, how important healthy living is, and dentistry is something which is not still given as much importance as it should be. I mean, of course, now people are getting conscious, but yeah, that's very important. So yes.
Thank you so much. So I think just diving straight in, I think you've practiced dentistry in both the US and India.
Yes.
So, I was very curious to know because there's always that debate about healthcare in the US, which is while it is of top quality, it is also very expensive, very unaffordable, very insurance dependent, and
Yes.
waiting times are very, very long for any
Right.
kind of healthcare service. With that in mind, just to be specific about the dental service and dental
Correct.
healthcare in the US,
Yes.
what are the two pros and cons of the American system versus the Indian
Yes.
system? So, two pros and two cons.
So, of course, there are many. I have been fortunate enough that I have been practicing for 16 years, and luckily, I've got chance to practice in India and abroad. I feel the best part is, that while India has dentistry at a very affordable rate, but at the same time, uh, there are certain things that we could learn from there, or we could bring it back here. So what I've realized in US, the best part was about follow-ups, the way they do their follow-ups, the way they do their post cares. Of course, in India, the good part is that as soon as you have a problem, there is always a dentist available. So availability is really good in India, but at the same time, it's good care. We could just probably do more of follow-ups. I feel insurance is a big factor which is missing in India. So I feel, for example, every US patient, they make sure that at least they get cleaning done twice a year, and that's because it's covered by their insurances. So if we could have something basic for everyone, and they know that at least the basic cleaning part will be covered, so that they don't miss on something big, which most of the times I see my patients come when they have pain or when they have problem. So if that could be avoided and regular checkups could be added, that would really help.
So I think from what we gauged, I think the two pros of the American system
Yes.
are that follow-ups are very, very prompt
Very
and
prompt.
post-care is managed in the best way possible.
Correct.
Second, because insurance covers so many preventive measures,
Yes.
not just in dental health, but in general,
Correct.
that people manage their health better and as a result come with lesser problems as
Yes.
opposed to Indian services. So, but the cons are unavailability of services. Again, as I mentioned, the healthcare
I agree
service
to that.
industry is very, very lengthy. And the second is the unaffordability. If you don't have insurance, then it
Yes.
can be it can be a big hassle to access
Correct.
healthcare at an affordable. Fair enough. And what are the differences in the types of dental issues you notice in the West in American patients
Correct.
versus Indian patients?
So, I always say that dentistry has a lot to do with diet, and that's how I love the wellness topic so much because I feel, diet is something that has a major impact, whether it's on your skin, whether it's on dental. So it has a huge impact on you. So I realized when I was in US, I would start my day with a big cup of coffee and cookies on the table. So I feel the sugar intake that we have in US or abroad was way more than compared to what we have in India. The portion sizes were really big.
Okay.
So I feel there are certain kind of issues that we see in US dental patient, like cancer is very common.
Okay.
So, I mean, now that I'm seeing that even India, we have enough of that, but more in US,
Okay. So you're saying cancer is more predominant in American
in the United States.
in American patients as a proportion of their population versus in India.
Yes.
And that is largely, or well, not largely, but to a large part driven by the fact that they have a large availability of processed foods very
Yes.
accessible to
Yes.
them,
Yes.
versus in India where we are still rooted in home cooked food, home cooked meals,
Correct.
and therefore our issues are less debilitating when it comes to cancer, but they are severe in other ways. Am I
Yes.
right in
Yes.
saying
That's
that?
the yeah. Yeah. That's correct.
Fair. So I think when you did move back to India, you got
Correct.
into cosmetology and smile treatments.
Yes.
So for our viewers, can you break down what cosmetology as a field entails, and what was the specific work you did in smile treatments, especially for Miss Universe, Miss India, Miss World
Correct. Correct.
participants?
So cosmetology, when you say, there is so much I can talk about, that I really love this topic, and luckily, even after coming to India, I had a great mentor. So cosmetology, it's a subject of my interest, and there is a lot to talk about, and I feel there are still things which we need to bring. Which we need to make people aware about. So, for example, cosmetology, when it comes to mind, it's all about, oh, I just want to get all veneers. And it's not always about that. It could be a minor change in your smile. I feel not everyone's teeth has to be white and sparkling clean, and it does not need to look like chiclets. That's what we call it in our dental terms. So I think that should not be there. It should be more of what is good for your face. So honestly, when you learn the cosmetology or a dental cosmetology in detail, it's more about what goes with your face. So I think that's important, whether it's the size of your teeth. It could be just the color. It could be just one bunny teeth that's bothering you, and but that a dentist can evaluate. We take into consideration the ratio of your face to your teeth and the shade that suits. So not necessarily everyone needs to have white teeth. It's just detected to each person of their with their individual need.
Fair enough. And with the Miss India, Miss World, Miss Universe participants,
Yes.
you said that you worked with a lot of them, and I think you worked with a few. You were one of the only authorized dentists
Yeah.
to work on their smiles and
Correct.
other parts. So, what was that process like? When did they come? When did they come to you? Was it months before their competition? What was the treatment period? How was it broken down until their competition, such that they were able to put their best smile forward?
Yes, so it's very interesting because recently I've had a girl who is a semi-finalist for Miss India, and it's just amazing to see their journey, because she came to me 2 years ago when she decided that she would want to apply. And it's not just teeth. I would always ask her, because I would be so curious, as to what they go through. And it was interesting to see that she was like, oh, I need to do classes for speaking. I need to do classes for, how to keep myself, or styling. And my dental is one of my issues. So she started her journey 2 years back,
Okay.
where smile design not necessarily again has to be veneers. So when we started her smile, we started actually by her ortho treatment. We started with Invisalign. So Invisalign is invisible braces, for your record. Just because she was already a model, and those braces could not be seen, but at the same time, I want to make sure that I don't drill the teeth too much just for veneer's sake. So we did her orthodontic treatment by Invisalign, where we aligned her teeth. Post that, there were minor corrections needed, and that was done with veneers. So they need to make sure that their smile is, I feel, when I see a person, or when I look at you, the first thing I see is a person's smile, and that's very important.
Yeah.
So alignment of the teeth, I think, especially in that sector, makes a huge difference.
Fair. I totally understand. I think there's a lot of training that they have to undergo to put their best
Yeah,
face
yeah.
forward.
It's actually to the
They're assessed
point.
by everything. I mean,
Yeah,
these competitions. You say what you want about them philosophically. Should they even exist? Beauty standards should
yeah,
be redefined. We always
yeah.
imitate the West when we approach beauty.
Yes,
But I think I have a very different personal opinion on that. That said, I really commend these participants for the dedication that they put in to every little detail of their life, the way they
yes,
live. I think
yes.
it's they have to, the way they eat, the way their body looks, the way their fitness is designed.
Totally.
So
I feel
kudos
it's
to them.
commendable. I feel
Yeah.
it's commendable. Yeah.
I think moving on to general dental health
Yes.
about our country, what is the one major dental problem that you think people develop as they tend to get older that can easily be avoided? And as a second question, What are the measures to take to easily avoid that problem? So the problem and the measures.
Correct. So, it's actually quite funny that we think patient always goes to dentist saying cavity hai mere ko, cavity hai, check kar lo aap. And the first problem I see is आप brush कम करो. And then they laugh at me looking like brush कम करो मतलब इसका मतलब क्या हुआ? And
Okay.
I have realized, Karan, if I'm seeing 10 patients in a day, it's like 6 patients are over brushing, and that's what's causing more harm than good.
And why so?
See, because enamel is the hardest structure of your tooth. Okay, so enamel is more like a raincoat. I always call that so that patient remember. I said, घर जाओगी तो याद रखना कि that is what is protecting your teeth. Now, a hardness of enamel is as equal to diamond. So imagine how much effort it's going to take to cut a diamond, right?
Yeah.
And that's what we are doing by using harsh brushes.
Okay.
So whenever you use hard brush, remember that you are actually removing the strongest layer of the teeth, which is enamel, and that's what causing sensitivity. So whether it is sensitivity with or whether it is thinning of the tooth. So for example, we always thought कि root canal तो तभी होता है जब cavity हो जाती है. But it's not the case. So a lot of times I'm doing root canal only and only because teeth इतना thin हो गया है कि sensitive हो गया है. Now that it's actually closer to the pulp, so we are doing root canal for nothing. We are doing root canal क्योंकि आपने ज़्यादा brush कर लिया.
So are those people also more sensitive to say cold items like ice cream?
100%. 100%.
Because I also struggled with that when I was younger.
Yes,
I used to
yes.
have my teeth used to tingle when I had ice cream.
Yes.
But eventually, as I've gotten older, and I don't know if it was overbrushing or what it was, but as I've grown older, and I brush once before I go to bed, once before I rise.
Yeah.
In that light, what is the recommended amount of brushing? Is there a one size fits all approach, or is there a general rule of thumb that you can give us?
See, I feel just to keep a basic thing in mind, I feel anywhere between 90 to 120 seconds is ideal. I just want to make sure, and I again and again emphasis on this point, that make sure the pressure is not harsh.
Okay.
So there are some really soft brushes, like extra soft brushes out there, and I actually recommend to a lot of patients. And when I do, I do get a call next day saying, Dr. Nisha, and I was like, क्या हुआ? And he's like, मेरे को लग नहीं रहा है मैंने brush किया, even after doing it. And I said, which means you are always brushing wrong.
Yeah.
So, I feel that, and this is such a small thing. And I realized when I was young, I would brush, and my mother would shout from the other room saying, I can't hear you brushing. Are you brushing? And now that I look back and I said, because you could hear me brushing, now my teeth has no enamel on it.
Got it.
So, yeah.
Very unique. Yeah. No, fair enough. I think as you're talking about hard brushes and just segueing into issues with dental products today. What are the three major issues with the two dental products that we use on a day-to-day basis? Toothpaste and toothbrush. What are the three major issues that you see in generally available toothpaste and toothbrush?
Correct. So, I always feel, I don't know why, staying in Bombay or India, I know we do travel, but we are very used to, oh, I'm going to UK, I'm going to buy this brand of brush or a paste. Oh, I'm traveling to US, I'm going to make sure I buy Crest from there. I feel, it's not that. The fluoride content is decided as per the place you live. See,
Got
you
it.
need to understand whether the water you are taking, it has fluoride in it. So you need to adjust your things accordingly. See, fluoride is an important content, and I feel fluoride should be there, but not necessarily fluoride. For example, again, coming back to salt, the toothpaste, which is a chemical free and triclosan free, it is a fluoride free toothpaste, but then it's still a strengthening one because it's been replaced with nanohydroxyapatite.
Okay.
So, but we need to make sure that those ingredients are there because those are the ingredients which are necessary for strengthening of your teeth.
The most commonly available brands that I think we all buy from our general Kirana
Yes.
store, Blinkit, Amazon, I think it's Colgate, it's uh, you know Close Up,
Correct.
so
Correct.
and I think Oral B, I think that is one.
Yes, yes.
And maybe I'm missing out, but maybe in parts of India, Vico and Sensodyne is also used very heavily.
Correct.
So amongst them all, is there one common problem?
Honestly, I grew up brushing with all of those toothpaste. So
Yeah.
it's not that they're bad. I mean, I have always been brushing, but now the more I realize, the more I'm into dentistry, I feel, I felt there was a need to create something that was very effective At the same time, it has to be environment friendly. I always feel it has to be sustainable. You need to make sure now that people are so aware, because everyone wants to look good. They want to eat the best of the organic food. They want to use the best of the shampoos out there, the best of the skin products out there. So why leave oral care behind?
Exactly.
I always felt, as soon as we do treatments on our hair and we say, sulfate free shampoo chahiye, yep, chemicals nahi hona chahiye, but something you've been putting in your mouth, it's always had that. So why leave that behind?
Fair enough.
So, I feel it has to be paraben free, sulfates free, triclosan free. We have again replaced fluoride with a very good ingredient. So,
Okay, in
yeah,
salt.
yeah.
So, what is the journey with salt? I think we've mentioned it a couple of times now, but I think as a more formal segue, what has the journey been with salt? You clearly mentioned that your inspiration was to, create something that was rooted in sustainability,
Yes,
also environment friendly, at the same time free of a lot of these harmful toxins and chemicals that
yes,
you mentioned that other toothpastes have.
correct.
So, when did this start, and how has it evolved thus far?
So honestly, it started out of nothing. It's more like, oh yeah, there has to be something good. I mean, what happens is, as soon as you start to find out, oh, this product has fat, and I'm going to stop eating this. So you make a conscious decision. You make a conscious decision to avoid that. So knowing more and more, 16 years into dentistry, I've realized that there were some products, but I was not sure always how we can come up with something new. So, of course, I have a great team in Salt. I have three more partners with me, and we all came to this decision. Let's try doing something where we've realized this is a sector which is completely unexplored. Where
Yeah,
and not that there is no awareness. So there was always a need for this. So we said, let's come up with something that's more sustainable, that's environment friendly. We wanted to make sure that it's truly a holistic experience for people who use this. So
sure.
yeah,
And
that's
what are the
how.
range of products that you have come out with?
So luckily, we are all so excited and thrilled that we try and launch at least 2 or 3 products every 6 months.
Okay.
So we have a range of morning toothpaste, a night toothpaste. Now that's the first question I get: why morning and why night?
Yeah.
And there are patients who will tell me, "Doctor, you pick which one should I use? I'll use only once." And I said, "It's not meant like that." So morning toothpaste, what we have is saffron. It has saffron and aloe vera. So that's actually to fight the cavities in the morning. It has a different purpose. See, why do you brush in the morning? If you've already brushed at night, why do you need to brush in the morning? Because that's more for bacteria.
Okay. That is accumulated while you've been asleep, is it?
Yes, while you've been asleep. So salt has a vanilla flavored, which I personally, it's my favorite because I feel it helps with my sugar cravings. Number
Okay.
one. Number two, I also feel that the good part is the ingredient that it has grapefruit and it has vanilla. It has a pH as such, which increases salivation in your mouth
Okay.
at night. And when that happens, you're less likely to get cavity.
Oh,
Added bonus, you get whitening effect because it has charcoal in it.
nice.
So yes,
And what
you.
is different in the night toothpaste?
So night is about this, and morning is about the cavity fighting.
About what? Sorry, night is
So
about?
night is about whitening.
Okay,
It's
got it.
about increasing the pH balance,
Okay.
so that you have more saliva in your mouth and less
And the
likely
morning
to
one
get
is to fight
cavities.
bacteria.
Yeah, and morning is
Fair.
to fight cavities.
That's unique. And I think it's the first brand that is doing a morning and a night toothpaste. I don't think
Yes.
anybody's ever come out with this. At least as far as I know, I haven't seen a brand in India that has a separate morning toothpaste and a separate night toothpaste. And I think it's very unique because
The best part is, you don't have to always have the same thing. I feel it becomes a little monotonous, and it's a little more exciting if I have a different paste to use in the night and morning. In fact, coming to mouthwash, we are the only alkaline mouthwash ever come out in
wow,
India. So every mouthwash you've been using, it has a pH less than 7, so it's more acidic.
acidic, yeah,
Yeah, so Salt has come up with mouthwash which is alkaline,
wow.
with amazing flavors like chamomile and
Yeah,
mint.
my mouthwash, when you usually do it, although you do feel a great sensation in your mouth,
Yes.
eventually there's a little bit of that burn that
Burn
comes
that
here
happens,
for a bit.
yes.
And I think it's because of the acid
It's because
content.
of the acid content in it.
One of the things that people generalize a lot. But first of all, fundamentally, what are braces used for?
Yes.
And what problem with braces did Invisaligners solve?
Correct.
So that is the first question. I'll come to a second question later once we're done with this.
Sure. So I feel, braces, I realized, when I was young or, pretty much जिसके सामने के दांत ठीक होते हैं उसका सब कुछ ठीक होता है. So we don't realize that braces are important for a person like that. In my personal opinion, braces as such, you always have an evaluation from a dentist. I would suggest age of 12 to 14, maybe 11 to 14, depending on when all
So
your
not before that.
Not before that, depending on all your permanent teeth are out.
Okay.
So that's when the actual effect will start. And I feel braces not necessarily always should be only done for aesthetic reason. I feel functionally a lot of people have crossbite. For example, when I close my mouth, my upper teeth are going to be like this and lower are going to be like this. A lot of people have crossbite.
Okay.
But the front teeth are all good, so they never realized that it was needed. So I think that's very, very important. You need to get it evaluated.
And so what problem did Invisaligners solve? Because I think braces was the only solution available from the age of 11 onwards for
Yes.
whatever age group you
Yes.
require those braces. So how are Invisaligners better than braces?
I wouldn't necessarily say better. See, of course, it has got its own convenience to it. For example, I so as I just mentioned, I have a model who needs to do her shoots and everything. So, I mean, Invisalign is as simple as you can just remove it and keep it on the side for 2 hours during your shoot. So, at any age, you can wear Invisalign because, especially at our age, I feel there are a lot of social commitments out there where I don't think I can even think about braces. So honestly, I myself, I'm on Invisalign right now.
Okay.
Just because, a small corrections or small gaps in your teeth, even that can be corrected naturally by Invisalign.
Got it.
So not necessarily every time you will have to put a crown or fill a cavity.
So, but effectively, they are both the same.
Effectively, they are both the same.
Okay, understood. Yes. Understood. It's just that Invisaligners don't pop out as much as say braces do.
Yes.
Okay.
And then no correction is needed. So I have a lot of clients who are actually abroad. Who don't stay in India, and for them, they want to get treatment. So we are actually treating them from here. We are giving them sets, Invisalign sets for 2 years. So they can actually carry back there, and by the time they come, I see perfect set of teeth.
And I think it takes like 2 to 3 weeks. First, they do a full scan. They send your measurements with that machine to the company Invisalign.
Yes.
I think a lot of people assume that Invisaligner is a product that is made by multiple companies, but I think it's Invisalign is a company.
It's a company. It's a company. They come and they scan your teeth. So the example I give to my patients is, for example, आपका ideal weight 55 है, and now you are at 60. So they are going to come. They are going to check you. They are going to make a plan or design a plan for you that will take you to 55, which is your ideal weight.
Got it.
For example, this is your 2 weeks of diet. This is your 2 weeks. Similar with Invisalign. So they come and scan your teeth. They make a plan for you. It could be 18 months. It could be 6 months.
Yeah.
And give you aligners accordingly.
Yes. Yeah. It's obviously there are a lot of structural reasons why one needs braces or Invisalign. So in many situations that can't be helped. So, as you said, that obviously there are structural reasons why one might need braces and Invisaligners, and that can't be avoided. That said, what can one do from the age of 0 to 10 to avoid having to use or prolong the avoidance of the use of Invisaligners or braces for as long as they can? What are the measures that they can take?
So, I feel initially it wasn't as much there, but right now we have myofunctional appliances. So, myofunctional appliances as such, for example, when the child is growing up, starting from the age of 6 or 7 years, we can have them wear the myofunctional appliance so that the jaw actually is trained to be developed in that way.
Got it.
So we don't have too much of correction when they grow up.
Okay. And is that available widely?
It's available, yes. It is available with orthodontist, and we need to have specialists on our panel. So,
but it has to be prescribed?
It has to be prescribed and done by doctors.
Okay.
Yes.
Understood.
It's a customized appliance for each.
And as you know, talking about appliances, what is that one piece of technology, whether in imaging, scanning, treatments, or anything else, that really revolutionized dental care as a whole in either India or across the world, before which it was a real struggle to solve that one problem?
Yes. So actually 2, I would say. One is the dental imaging. Of course, now we have science and the technology which is so advanced, so we can actually do 3D imaging and we can plan out before even we see our patient.
Okay.
So, as soon as we see our patient, we do the digital scanning, which gives us a fair idea on how much bone he is going to have, or what kind of things would be needed, what kind of treatments would be needed. Coming to treatments, I would say implants for sure.
Okay.
That has really changed dentistry big time for us.
And when did that come about? If
So it's
was it there when you started, or
not there when I started. I mean, it was probably there, but not as easily
accessible?
available and accessible. So I would give you a small example. For example, किसी का एक दांत चला गया है, तो हमेशा ये होता था कि अच्छा अब ये एक दांत नहीं है तो क्या करना चाहिए. तो the simplest reason or simplest solution which we as a dentist or I have also given is आजू बाजू के दांतों को grind करके bridge लगा दो. And I think that was always there. And believe me, now after so many years of practice, what I'm seeing is 5 years or maybe 10 years max. When the patient comes back to me and says, कि, doctor, वो bridge जो आपने लगाया था उसमें pain है. I remove the bridge, what do I see inside? There is always marginal leakage. So those two teeth which I used for the bridge, either they are completely spoiled and they need to be removed as well, or they need to be root canal treated and maybe put a bridge again. Now, what if they are completely spoiled? This is actually when it gets very funny, I feel. So when they are completely spoiled, the doctor would say, ये दो भी निकाल दो और बाजू के दो ले लेते हैं. And I always say, ऐसा बैंड्रा वर्ली सीलिंग बनते जाता है. So now implants has come to rescue. So if you don't have one teeth or two teeth, just one tooth or two teeth, you just do implants and that place is done, sorted. The tooth is already there. और बाजू के दो को छोड़ दो. Don't touch them, I would say.
Fair. Oh, that's very interesting. I think I never knew how this is very funny, but at the same time, yeah, it's very interesting. Also, where does technology fall short today? What are the problems that you still struggle with that you think could be alleviated with the use of technology?
See, I feel, I mean, right now we are really at a point. I feel more, I mean, technology, of course, but I feel more than technology, a little bit more of awareness, I would say.
Okay.
I would say more of awareness, like a little bit awareness. I personally feel, what is the first time a person should see a dentist? At the age of 6 months.
Okay.
And people are shocked. They say, why? I said, even when the first tooth comes, just bring them to a dentist for like a minute and let me give them a toy. Let's build this healthy relationship between dentist and a patient. Because not necessarily every time the patient needs to have pain and you need to bring them to the
Correct.
dentist. And then, of course, I'm going to inject that child for the first time and he's going to say, oh my God, I don't want to go to her for my life again.
Yeah.
So, I
To build
feel
that trust.
awareness, regular checkups. For example, a small thing I'll tell you, our first molar that comes at the age of 6 and that is there until you live.
Okay.
So that comes at the age of 6 when you are not even aware. And the grooves of the molar are very deep. So example, I always say a treatment called as sealants. Now sealants is something that, anything a child eats is going to be stuck into those grooves. And I always say, let's do sealants. Sealant क्या है? Sealant सिर्फ क्या है? एक cement है, which you can just put on the tooth and cure it. So actually, whenever next time a child is eating a cookie, it's on that cement and not on their teeth. But people say, यार अभी से क्यों करना है? इसको filling मत करो डॉक्टर, जरूरत नहीं है. So I think small things, small tips, those awareness.
Fair.
Yeah.
So I think technology has caught up, but people's awareness towards
That
dental health,
really
we still have a
needs to be.
long way to go.
Yes.
Yeah, and I think that is actually a very valid point, because oral cancer has been growing a lot even in India, as you were
Big
mentioning.
time. Big
And
time.
so, how common is it? What are the early signs, and what can one do to, when you do notice
Yeah.
any kind, when there are early signs and God forbid you are diagnosed with
Yeah.
oral cancer,
Yeah.
what are the measures that the patient and the caregiver can take to
Yes.
ensure that the cancer does not increase from one stage to the other and does not progress?
Correct. So, there are actually different reasons why cancer could happen. Of course, tobacco or smoking being the biggest, which we all are aware about. Like, there are people, who will just keep tobacco here. वो यहीं पर दबा के रखते हैं. And you'll always see, like, वो बात भी कर रहे हैं तो थोड़ा उनका speech. And I'm like, आपका हो जाए तब आप आ जाना अंदर clinic में. So, I think tobacco has always been one of the biggest reason. But one reason I think which not very many people are aware about is our last wisdom tooth. So a lot of times we feel like wisdom tooth है पर अभी जरूरत नहीं है निकालने का बाद में निकाल लूंगा. And a lot of time people will repeatedly have cheek bite. Cheek bite होता है तो सबसे पहले अल्सर होता है. As soon as the ulcer happens, okay, you will go to a dentist, they'll write an ointment. Within 2 or 3 days, the ulcer is gone. Ulcer is gone as in the pain is gone, but you need to make sure you check again and again if the ulcer is still there. A non-painful, a not painful ulcer can actually lead to cancer, which we are not even aware about. So it looks like just a white patch. We call it leukoplakia in our language. So leukoplakia is something which is a small ulcer which can actually lead to cancer. That can happen because of a cheek bite. It can also happen if the person is keeping tobacco in mouth for very long. For a lot of time, people who don't eat for long hours, they actually have this habit where they'll just stuff tobacco in the mouth. And later, see, I feel the regular checkups really help with that. So so whenever I see a patient that has cancer, first thing is there will be a limited mouth opening. And then I'll suddenly be like, "Arey aur muh kholiye," and they'll be like, "Nahi, muh nahi khulta hai." So then you realize, oh, now let's check more. Now the area inside their cheek is always very rough and it has a scaly appearance. That's when you realize, okay, now this needs attention. It can be red, it can be with white patches. So, a regular dental checkup, when you go to a dentist, these things could be avoided. That's why
And
we
when do
say,
these start cropping up? At what age?
no, so it's not necessarily age.
Age related.
See, it is funny that wisdom tooth is one, but even stress can cause cancer. So even stress can cause ulcers. Now these ulcers can lead to cancer.
Yeah.
So it could be at any age, but
And there's that entire science behind if you eat foods that cause inflammation inside your body that then cause ulcers.
yeah.
So is that accurate?
See, to some level, to some point. So of course, some food will cause heat and that could cause ulcers. But generally, those are the ulcers which can heal itself. As soon as you stop doing that habit, the ulcers can heal itself. But yeah, those points are really important, I feel. When you see that, there is a white big patch in your mouth and okay, it's been there, but it's not painful, that's all the way more reason you need to evaluate it.
Fair enough. So I think while we've seen the effects of stress, and we've discussed a lot of preventive health measures. I think
Yes.
primarily being checkups, because everybody's dental profile is different, and therefore
Yeah.
it's
Yeah.
only a qualified dentist and a dental assessment that can help one truly understand what their issues are.
Yeah.
uh, you know Healthy living also contributes, as we said.
100%.
The
Yes.
smoking, alcohol,
Correct.
processed foods, sugar,
Yes.
they contribute a lot towards oral cancer
Yeah.
and other dental challenges.
Yes.
With that in mind, as a dentist, what do you do to take care of your personal health and well-being? What measures have you incorporated that have greatly benefited you?
Correct. So, I always say that, of course, morning brushing, night brushing is very, very important. But I've realized a lot of times when food is getting stuck in teeth, especially I have problems with one or two of mine. That's the reason I started with the aligners, because even with the smallest of the gap, and you start with aligners, it can close that. So I always tell people कि मीठे से मत डरो, मीठे से cavities होता है, but that's not the only reason. I would say the more dangerous thing is food getting stuck in your teeth. So, I feel water flosser has again been a very good thing in dentistry.
Okay.
For example, people would floss and they would always come back to me and say, कि doctor, आपने floss तो बोला था, but my teeth is always bleeding. My teeth are always bleeding when I floss. So I feel, water flosser is something where you just fill water and it's just like a spray, like a jet spray in your mouth. So I feel that is one thing for people who have crowns. I do. So for people who have root canals or who have crowns, if you can use that on a regular basis to make sure that you have fresh breath and there is no food stuck in your mouth. Again, I think another thing is tongue cleaning is something that I regularly do.
Okay.
I feel brushing is something which we all know about, but what about tongue cleaning? It's always the tongue where the bacteria are. There is always a biofilm which is slightly whitish on the tongue. If you don't brush for 2 days, you will, or even if you don't, if you just wake up in the morning, you're going to see that. So tongue is again very important to do
Okay, yeah,
cleaning.
that's very
It's,
unique.
yeah,
And earlier we were taught as kids to use that
to
cleaner,
use that
or
tongue cleaner.
then behind the brush also. I think
Yes,
there's that
yes. Just need to make sure that the pressure is right and we are not too harsh on it again.
fair. And finally, dentistry as a field is very very popular now as opposed to
Yes,
earlier. So,
yes.
what is your advice for MBBS students who are thinking of pursuing their specialization in dentistry? What are the pitfalls that they can avoid? What are the mistakes that they can avoid to ensure that they extract the most out of their education, such that when they
Yes.
enter the world and they start practicing, they already have an edge ahead of other people in their field?
Correct. See, I feel, of course, everyone has their own preference, but for me personally, I always feel that coming straight from college, there is क्या होता है कि जब तुम कॉलेज में होते हो और जब तुम एक्चुअल खुद की प्रैक्टिस स्टार्ट करते हो, इट्स अ होल न्यू दुनिया यू गेट इनटू. So when I started my private practice, luckily I had worked with a dentist for almost 7 to 8 years. Even after coming to India, I had worked for 7 to 8 years. And that gives you a good insight on how things should be. Because there is a very different dentistry that you do in college compared to very different dentistry which you actually do in your private practice. So I feel, whenever I agree, it takes a long time to become a dentist, but even after that I would advise at least to spend some time whether observing or whether learning
Workshops,
from
maybe?
private practice. Yes, there are a lot of workshops out there.
Okay,
So learning from a private practice, and post that you should start your own practice.
got it. So, thanks. I think we've covered everything. Thank you so much for joining us.
Thank you,
And it's been
Karan.
a absolute pleasure.